So far during the month of February, we have learned that heart disease is preventable. But how so? Charity Carlisle from Florida Hospital is here to explain. Charity, welcome to the show. How are you?
Good. Thank you very much for having me.
We're glad that you're here. And in February, I think we do talk about heart disease and really share the spotlight. But each time you look at these statistics, I mean, it really hits home. We're talking about 610,000 Americans lose their life because of heart disease?
Absolutely. That's 1 in 4 people. So 2 couples together, one of you may not be here next year due to heart disease. Kills that many people annually.
The thing that I know we kind of stressed there in the open that you and I were talking about, preventable.
Absolutely.
Preventable. What can people do?
So step back a little bit. There is preventable risk or preventable things we can do to address, and there's also things that we're born with.
Okay.
Those are non-modifiable or uncontrolled. So your gender, your age, your ethnicity, those are things that we don't have a choice in.
Right.
Modifiable ones or controllable ones, you can stop smoking, you can lower your blood pressure, you can get up and exercise and be active, decreasing your stress levels, lower your cholesterol. Those are the kind of things that we can control.
And I think something else you can control is knowing maybe what's going on and taking a closer look at the heart. And I know that's something Florida Hospital is passionate about. And you're so passionate that you're actually offering a screening for people, right?
A screening this Friday at Florida Hospital Carrollwood on our campus in the auditorium. We are going to screen patients for high blood pressure. We're going to screen them, check their blood sugars. We're going to check cholesterol. And we're also going to have checks for BMI or your body mass index. The good thing about this screening is you're actually going to get to sit down with a medical provider to go over with your results, whether it be a physician, a nurse practitioner, or a PA. They'll be able to read your numbers, go over, maybe give you some tidbits on what you can do to improve, or say, hey, big red flag, we need to get you in and further treatment is advised.
You know, I'm curious, if people are watching out there and they want to say either I have a history of or I've never been tested, what are some things that people need to consider to think, yes, I'm one that should get screened?
So do you have a family history? Good point. Do you have a family history? Did your parents die of an early age from a heart attack? Did you hear somewhere in your family had a history of hypertension? Do you regularly have high blood sugars, but you're kind of borderline? This might be a good spot check, a medical screening for you to come in, sit down. Maybe you have 3 risk factors that are questionable, and it's time to see a specialist or a further someone else who else can help you.
And a screening like this, you talked about the 4 components that they do make it up. Should a person get tested regularly, or how often? Say someone's watching, they say, hey, I was just tested last year. Do they get tested again, or how often should people have this screening?
So, again, good question. I would think annual checks, especially as you get older, would be a good spot check to get looked at and see what your numbers are. Certainly, though, if you have risk factors such as smoking or high blood pressure, you have a family history, perhaps you're Afro-American, those are higher risk factors that you need to be looked at more on a regular basis.
I'm curious, if you had the chance to give people, you know, one piece of advice to really protect themselves, help fight against heart disease, what would that be?
So we talked about exercise a lot and not being stagnant. I think it's not just physical exercise, but also mental, that you need to let go of the stress that you have, the anxiety you have. You need to get up moving, get outside, enjoy the fresh air, get some vitamin D, you know, let yourself go so that you can get relaxed.
And of course, it's also get tested on that screening. So
Absolutely.
let's revisit the details of the screening. Who could qualify for this screening as well?
Anybody can come and be seen. Again, you're going to get your blood pressure checked, your blood sugar checked, your cholesterol checked. Fasting would be ideal, but it's not mandatory. And also your BMI. So you'll get your numbers reviewed by a medical provider, a doctor, a PA, or a nurse practitioner, and they'll be able to give you some quick tidbits or tell you that you need a further assessment.
And do people just show up, or do they have to register in advance?
You can do both. We have it on our Florida Hospital Carroll website, or you're more than happy to show up, and we'll see you on Friday morning at Florida Hospital Carrollwood.
Right. So glad you're doing this. Thanks for coming in and sharing the information.
Thank you very much for having us.
We need to spread the word as well.